Now, this is a very interesting skill called Focus Screener, and the app developers listed as Dr. Echo. And the description is it's a symptom checklist. It's a instrument consisting of the 18 DSM-IV-TR criteria. 6 of the 18 questions that this skill will ask me were found to be the most predictive of symptoms consistent with ADHD. So if the user scores less than 10, very low chance diagnosing with ADHD, between 10 and 14, moderate chance of diagnosed of ADHD, a score of 15 and higher is considered to have a very high chance to be diagnosed with ADHD. However, they do put a disclaimer. This is not a substitute for medical professional advice. So let's try it anyway. Echo. Open focus screen. Echo. Open focus screener.
Hello, I hope you're feeling well today. Disclaimer, this is not a substitute for health professional advice. This test is just intended for self-assessment. The Symptom Checklist is an instrument consisting of the 18 DSM-IV-TR criteria. 6 of the 18 questions were found to be the most predictive of symptoms consistent with ADHD. These questions are the basis for the ASRS V1.1 screener. I will ask you 18 questions. Please answer the following questions, rating yourself on each of the criteria set using the scale. As you answer each question, choose the number that best describes how you have felt and conducted yourself over the past 6 months. Let's begin. Question 1. How often do you have trouble wrapping up the final details of a project once the challenging parts have been done? 1. Very often. 2. Rarely. 3. Never. 4. Often.
1.
That answer is copy that. Your answer is 1. 1. Your score is 0. Question 2. How often do you have difficulty getting things in order when you have to do a task that requires organization? 1. Never. 2. Often. 3. Very often. 4. Rarely.
2.
That answer is copy that. Your answer is 2. 2. Your score is 0. Question 3. How often do you have problems remembering appointments or obligations? 1. Often. 2. Never. 3. Rarely. 4. Very often.
2.
That answer is okay. Your score is 0. Question 4. How often do you have difficulty keeping your attention when you are doing boring or repetitive work? 1. Very often. 2. Rarely. 3. Often. 4. Never.
99.
Sorry, I'm having trouble accessing your focus scene skill right now.
So that's really interesting. I wasn't planning to go all the way to the end because I found it quite laborious compared to, say, a pen and paper, and also pretty monotonous voice from Alexa in terms of the questions, the tone of voice that she's asking the questions. And what's really fascinating there is how it just kicked out of the skill because I didn't answer the question with one of the 4 options that it had given me, and I just gave a random 99 answer to see how it would respond. Instead of saying that's an invalid response, please enter, say the correct answer, or in between 1 and 4 let me repeat the options. It's basically just exited the skill completely, which isn't very good given that it's supposed to be screening for ADHD using these the 18 DSM-IV-TR criteria. So I don't know whether this was just done as a test skill or whether they've got any serious plans for it. But what do you think? Would you, if you're a psychiatrist and you're dealing with kids and you're screening them for ADHD, would you say, okay, just download this skill at home and you can use it yourself with your parents or your family members, or you could use it on your own? I mean, is this irresponsible to have this kind of skill the way they've set it up in for the Alexa services? Let me know. Thanks for watching. Bye for now.